Me pyydettiin tohtori Waismannin haastattelu uudestaan ihan tätä lähetystä varten. Katsotaan vielä, millä lailla hän perustelee tätä omaa menetelmäänsä.
I don't treat drug addiction. I treat opiate dependency, which is a central nervous system disorder. So, historically, this condition was being treated by psychiatrists mainly, by psychologists and by social workers. Actually, when we recognize this condition as a central nervous system disorder, and today based on the new biotechnology that was being developed in the last 20 years, we can understand much more about opioid receptors than we did 20 years ago. And the pharmacological industry supply us with effective blockers, antagonists to the same substances. So we use new generation of drugs to reverse a central nervous system disorder. So what I do is not something fantastic, it's not nothing amazing, it's just good medicine based on good biotechnology. So I don't judge patients to try to understand why they start using drugs at the first place. I see the condition that I face, which is an opiate dependency. I block the opioid receptors. By doing that, I accelerate the withdrawals, so a patient don't have to vomit, have diarrhea and terrible pain for a week or 2 weeks. And then I control the adverse effects of this blockage, which are the withdrawal syndrome, with good biotechnology in intensive care unit. As an ICU doctor, that's what I was doing all the time with other conditions, You have a patient with a condition, and we control the condition in the ICU. So it's a very logical treatment that psychiatrists usually have a hard time even to look into that. But whenever an anesthetist, an ICU doctor, come to see what I'm doing, at the spot they understand exactly which are the neuropharmacological basis of my treatment, and they see that it works. So I don't have, after 5,000 patients treated, where I succeed in each one of them to reverse opiate dependency and to block the opioid receptors, I'm not busy anymore trying to convince people. All I can say, if this is a tragedy, this condition, this epidemic in the world, people are dying through it. It's spreading AIDS, hepatitis, destroying homes, crimes, prostitution. If 20% of what I say is correct, it's twice better than anything else. Some people say the Waismann method is very radical because he uses anesthesia. Anesthesia is not radical for facelifting. Anesthesia is not radical for any plastic surgery, for cosmetic surgery. Why anesthesia is radical to be used in a very painful condition that people die every day from that? Not from the condition, but because of the fear of going through the withdrawals. So they are in the streets spreading AIDS, hepatitis, overdose and crimes throughout society. So I think we can learn from history. If we don't treat our problems, they come back to our face. And that's the issue with heroin dependence and opiate dependence. I think the big concern worldwide, you could see almost each and every speech of Bill Clinton when he wants to make he talks about that. In Europe, everybody's concerned about that. But why this is coming back in our face as a society with hepatitis, AIDS, and crimes? Because we, as doctors, did not provide to this condition an effective, safe, and humane treatment. So I think what I'm doing is just using good biotechnology, taking consideration the 3 points that I said before: effectiveness, safety, and humane treatment.